My son was born on November 20th of 1985. We had no reason to suspect that anything was going to be different than any other normal baby. My husband and I are both nurses. We were going to go right back to work and be the yuppie parents of the mid-'80s. And that day, our lives changed. He was born on a cold wintry morning. He was fine. Paul came home. 1 week later, we were back in the hospital because he had developed his jaundice from bilirubin, which is not an uncommon complication post-delivery, especially with an early baby, as we were told. He went home. We went back into the hospital again. At that point, a resident told us that evening, "Did anybody tell you your son has a heart murmur?" Again, being nurses, we trusted into the physicians, and we all thought it was because he was a new baby. He was a month early. They explained it was a common complication at an early age like that and being premature, that it was probably something that would close on its own within the first month of life. 24 hours later, he was in crisis. 3 days later, we were transferred to Children's Hospital of Michigan. We thought we had one heart defect, which is a ventricular septal defect, which is missing the septum between the two lower chambers of the heart. The cardiologist informed us that snowy morning on that Saturday that we were dealing with a bigger complication. Now we had two. We were looking at a coarctation of his aorta, a narrowing and shortening of the diameter of his aorta to support his bodily functions. We were sent home, told to beef him up, give him his cereal, and bring him back for a cardiac cath right after Christmas. Following the cardiac cath, he went through his first surgery. It was open chest surgery to repair the aorta, which with itself, besides the complications of surgery, is post-op because of the opportunity for blood flow to his brain and to his body. Things could happen. He survived. He did well. We were doing okay. We thought we were going to buy time till he's 3 years old to repair his septal defect, but we found 12 days later he went into a total collapse and required a second surgery, this time open heart surgery, to repair the septum. You're walking your child not once, but twice to the operating room, carrying your firstborn, the firstborn grandchild, and giving them to the doctors and nurses, and you just pray that things are going to be well and you're going to take that baby home. 45 days later at ICU, with much pleading and cajoling with our physicians, we were able to take Paul home. We begged as being nurses that we would do whatever it took to keep him home. Send us a visiting nurse, send us a respiratory therapist, send whatever you needed, but we all needed to go home as a family, and we did. He had lost his ability to suck, so we had to learn how to use a bottle again. He was tube-fed at home, but he grew and he grew, and by Mother's Day, he had put on weight and he had his first outing. By 9 months old, he was off all his medication. By 10.5 months old, he was up walking. Today, he's a 27-year-old man living in LA, working for NBC, doing what he loves to do, which is editing scripts and writing for television. He received a degree in musical theater performance and did a little stint in New York and has now moved out to LA. He's healthy, he's happy, he's on no medication, he has no really activity restrictions. He sees his cardiologist every 2 years, and he was told at his last visit that he was a perfect repair. I would tell any parent, when you bring that baby home, and I know we all look for fingers and toes when they're born, and we should be watching for any subtle signs, and that's what they told us. As a parent, we would be the people who would notice any changes. So love those babies, look at them, take them to their visits, stay on all medications or any diets or anything that they tell you to do, and you too, I wish for you a healthy outcome as we have had.